Bismillah Rahmanir Rahim. This is Ultrasound Case 1. Let's start this lecture. Today we will discuss a case of missed abortion in the pregnancy of 8 weeks. Now we are going to see uterus, urinary bladder and gestational sac. This is uterus and this is urinary bladder and this is gestational sac. You can see it very clearly, urinary bladder, uterus and gestational sac. Now you can see it very clearly. There is uterus, urinary bladder and gestational sac. One by one I have marked it. Here you can see now we are trying to focus on fetal pole. Now we are trying to focus on fetal pole in gestational sac. You can see it very clearly. There is a gestational sac and we are trying to focus on a fetal pole. There is a small fetal pole in this gestational sac. You can see it very clearly. Yes, now you can see a small fetal pole in gestational sac. Here you can see a small fetal pole in gestational sac. Yes, this is gestational sac and this is uterus and this is a small fetal pole. You can see it very clearly. There is a gestational sac and there is a dead fetal pole. You can see it very clearly. Here you can see a dead embryo. This is a dead embryo. This is uterus and gestational sac. Okay, let's see cardiac activity of this fetus. Now we are seeing to a cardiac activity in this fetus. Now you can see a tiny embryo. Yes, let's see cardiac activity of this fetus. Oh no, there is no cardiac activity in this fetus and gestational sac. You can see it. There is no blood flow and no blood flow and in this fetus and small embryo and gestational sac. Here you can see I will try to zoom this image of this fetus. This is a dead embryo. You can see it very clearly. You can see it. There is no blood flow inside the small embryo and gestational sac. Yes, I will zoom it and I will to try zoom it and see you. This is a dead embryo. Yes, you can see it very clearly. This is a dead embryo. I have zoomed this picture. Now you can clearly see in this there is no cardiac activity in this visible and there is no blood flow seen. Okay, no cardiac activity is visible in this scan. Yes, you can see it very clearly. This is a tiny embryo and this is a dead embryo. Here you can see a tiny embryo very clearly. Now we are looking for a tiny embryo and this is a gestational sac and there is no cardiac activity seen. Okay, now we are trying to focus on this embryo. Yes, we are trying to focus on this embryo. Okay, this is gestational sac and this is a small embryo which is dead. This is a case of missed abortion in pregnancy of 8 weeks. There is no cardiac activity and no blood flow seen in this embryo and gestational sac. But there is no more product of conception except this tiny embryo. Yes, you can see it very clearly. There is no product of conception except this tiny embryo. Okay, you can see on left side there is a dead embryo and right side there is a gestational sac. You can see it very clearly, dead embryo and gestational sac. Here you can see. Now we will take the measurements of gestational sac and this tiny embryo. Okay, now we are taking the measurements of this gestational sac and tiny embryo. This is the measurement of gestational sac and here this is the measurements of small embryo. Okay, here now again you can see the uterus and gestational sac and embryo. This is gestational sac or this is a embryo and there is a gestational sac. Okay, this is uterus, this is small and dead embryo. Okay, you can see it very clearly. This is embryo and uterus and gestational sac. Okay, thank you so much for watching my all videos. If you are new on my YouTube channel, please like, share and comment on my video. If you are new on my YouTube channel, please subscribe my channel. God bless you.